A lot of women want to know what to expect during labor, and specifically, they want to know which part of labor is going to be most painful. Now, labor is broken down into different stages and phases. And the first stage of labor is all the time you're dilating. The second stage of labor is basically pushing time, from the time you're 10 centimeters till the time the baby's born. And the third stage of labor is from the time the baby's born till the time the placenta's out. So basically you have dilating, pushing, and placenta. Within that first stage, there are 3 phases. They are known as early or latent, active, and then transition. You're probably going to spend most of your time in the early or latent phase of labor, especially if it's your first baby, because this is the time your body's deciding to go into labor, and this can take days. You may have like days of unproductive contractions before you actually go into labor and have your baby. Contractions during this phase, especially during the early labor portion, may only last like 20 to 40 seconds. They're more uncomfortable, not necessarily painful, and they're very irregular. So once they start to become regular and intense, that's when you pay attention. You start timing them. And when they're like 4 to 5 minutes apart and you're over 37 weeks, then it's time to go to the hospital and see if your cervix is changing as a result of the contractions. Even when your cervix starts actively changing, you'll probably go slower during the latent or early phase of labor, especially on your first baby. You may only go like a ½ centimeter per hour or a centimeter every 2 hours. But then the next phase is called active, and it's called active for a reason because things start to pick up. And from 4 to 10 centimeters, you'll probably go about a centimeter per hour. And then you go into transition between 8 to 10 centimeters. And this is probably the most intense part of labor. As your body gets closer, your contractions are usually like every 2 to 3 minutes. They may last anywhere from 1 to 2 minutes, and it's really intense. But don't let all of this fool you, because I've been a labor and delivery nurse for a long time, and a lot of women feel like they're experiencing the most intense pain they've ever had in their life in the early phase of labor. I've read books before that equate a smiley face with each different phase of labor, and during the early phase, there's someone smiling. And then during the active phase, there's someone with like a little bit of a frown. And then during transition, there's someone with a big frowny face. And I don't think that's a good representation of what it's actually like. You may be freaking out in the early stages of labor because you've never had that type of pain before in your life. Pretty much it's safe to assume that labor is going to hurt. And we talk to you a lot at the hospital about pain, and we ask you to rate it on a scale from 0 to 10. 10 being like surgery with no anesthesia. It's the worst pain you could ever imagine happening. Not the worst pain you've ever had in your life up to that point. Because we have a lot of women who come in and rate their pain at a 10, and then we check their cervix and they're 1 centimeter. And then they realize that their pain scale has to adjust a little bit, and maybe realistically their pain's only like a 5 or a 6, and they end up going home because their cervix isn't changing as a result of the contractions they're having. And that, again, is the true definition of labor. So if we send you home to keep working at it, then of course the natural question is, well, when do I come back? And all we can say is when it hurts more. So it's actually a good question to ask yourself too. On that scale from 0 to 10, how bad am I really hurting? Because if you say, okay, realistically I'm a 5 or a 6, and then we send you home, and then maybe hours later, days later, weeks later, whatever it ends up being, you're like, okay, now this is a 7, 8, 9, 10. You know, it's time to go back to the hospital and get your cervix checked again to see if you're changing. It's also helpful for you to answer this question for us because it turns a very subjective conversation into something that we can both understand. It becomes objective. So if you tell me that your pain was a 4 when you walked in the door and then you're an 8 an hour later, I'm like, whoa, she's crossed the threshold. I can understand that that's hurting quite a bit. And it's also helpful if we're trying to medicate your pain. Like say your pain's a 10 and then we give you an epidural and you tell me your pain's a 0. Then I know that it worked. Or maybe you had a C-section and we talked to you a lot about the pain level that we're trying to achieve. We can't get you to a 0, but like a 3 or a 4 is functional for most people. So if you're a 6 or 7, you need to be medicated. And then after we medicate you, if you tell me your pain's a 3 or a 4, then I'm like, okay, good, it worked. And she's in a functional range. So this is a very helpful conversation for us to have with you and for you to also think about yourself. We can't talk all about pain without talking about how to control it. And it comes down really to your desires for your labor and delivery experience. Are you wanting to get an epidural, or are you wanting to do it without? And if you're wanting to do it without an epidural, then you need to prep in the months leading up to delivery by taking classes that will talk to you in depth about breathing, relaxation, and different positions that you can try during labor. You need to bring your support person with you so that they are invested and they're ready to help you during the process as well. If you decide today that you're going to go unmedicated tomorrow, it's going to be very similar to deciding today that I'm going to run a marathon tomorrow without doing any training. It won't go well. So you can look into lots of different methods of breathing and relaxation and find the one that's right for you. You can also ask your doctor to see if they have any recommendations based on their knowledge of your circumstances. And then if you're planning on just getting an epidural, you of course are still going to experience pain because there's time where you're going to be contracting and hurting before you can get the epidural. So you still need to think about breathing and relaxation. Probably the thing I tell my patients most at the hospital is to take slow, deep breaths. You constantly have to be reminded to do that. Think about what you'd do if you drop a hammer on your toe. You naturally tense up and you hold your breath or you hyperventilate. And those are your only two natural responses to pain. So you quite literally have to take breathing out of automatic and put it into manual and focus on taking slow, deep breaths. Because if you did nothing, every 2 to 3 minutes when you contract, you're going to hold your breath. And that's not good for you or the baby because it messes up your oxygen and carbon dioxide balances in your body. And that affects how well both of you can function. And it can also inhibit progress during labor. So you have to be well controlled. You need to breathe. And I have a couple pieces of advice for you. One is that it's easier to stay in control than it is to get it back. So you're going to be tempted to scream or cry when you're in the trenches. And maybe for you, that'll happen in the active phase. Maybe it'll happen in transition. But if you can keep control, it's going to be easier to do that than it is to get it back. And also remember that at the end of it all, you're going to meet your baby. And no matter how bad you don't want the next contraction to happen, that's not going to stop it from coming. And so have a positive attitude about contractions and just think that this is one closer to meeting your baby. And if you change your attitude about it, you breathe and you stay on top of the pain by focusing, breathing, relaxing, you will do well. When you come to the hospital, your nurses are automatically going to ask you about your desires for pain control. And really, there's 3 categories that you can start out in. And you're welcome to change at any point in time, but we just want to know what we should do starting out to help you. So the first is, I'm not a pioneer for a reason. I was born in this day and age so that I can get an epidural no matter what. The second is you're kind of a wait and seer. This may not be as bad as everyone says it is, and you've done some prep work and you're going to try to go unmedicated, but you're leaving yourself an out. And then the third category is that you're not going to get an epidural no matter what. For wait and seers and for those who don't want an epidural, there is IV pain medication, and you can talk to your doctor about what they commonly prescribe during labor, and they can talk to you about the side effects and the potential risks and benefits associated with those medications. And then, of course, an epidural is an option, especially if you're a wait and seer or if you're just planning on getting one no matter what. And also, I would say those who are planning on going unmedicated no matter what should, in the back of their minds, still leave themselves an out, especially if your doctor recommends one for a medical reason. There are a couple of different situations when we do recommend epidurals. And so, again, if you have questions about that, you can talk with your doctor. They're always going to be your best resource because they know the specifics of your situation and can give you tailored advice. And if you have more questions in the future for me, feel free to ask them on our Facebook page at facebook.com/Intermountain Moms, and recommend us to your friends and family too.